In 1987, a small group of caring individuals had a vision to establish a nonprofit organization to support suicide research, education, and prevention efforts that could be sustained into the future. These founding families, each of whom had lost someone to suicide, joined with scientists, researchers, and clinicians to create the American Foundation for Suicide Prevention, or AFSP. Over 30 years, AFSP has kept that promise. We raise awareness throughout our advocacy efforts, both nationally and here in Massachusetts. We fund grants to help prevent suicide. Last year, over $4.3 million for research in areas like neurobiological study, psychosocial study, genetic treatment, community, and loss survivors.
It's critically important to use science to base the educational efforts and policy efforts that AFSP creates, because there have been a lot of assumptions that have been wrong about suicide. And we've learned a lot from the research and are still continuing to learn more and more every year. And so as those results come out and are replicated, AFSP wants to shorten the time to translate that research into lay knowledge so that families and communities can prevent suicide within their own communities.
We provide aid through interactive screening programs and education with programs like Safe Talk and It's Real, our new documentary directed at college students who may be at risk, and Talk Saves Lives, a community-based presentation that can help anyone learn what suicide is, who it affects, and what you can do to prevent it.
If you're a parent and you notice that your child or perhaps one of their friends is exhibiting warning signs for suicide, the question is really, what can you do about it? I think the most challenging part is to take the first step, and that's ask if they're okay. You know, is everything all right? Are they thinking about suicide? We sometimes don't ask that question because we're afraid of the answer. Sometimes we don't ask that question because we don't have a clue what to do if they say yes.
And we bring hope to those affected by suicide.
Every single opportunity that I experience with this foundation blows me away, and every door that opens terrifies me, but I continue to walk towards that discomfort because I know it's necessary for growth. And I want others to see that that's possible for them as well.
AFSP's Project 2025 initiative is working toward the goal of reducing the suicide rate 20% by 2025 by concentrating on 4 critical areas. We're partnering with the National Shooting Sports Foundation to reach thousands of gun owners, providing educational materials about warning signs and suicide prevention information. We're collaborating with large healthcare systems to help identify those at risk for suicide, implementing screenings during primary care visits, and providing patients with short-term interventions and better follow-up care. We're working with emergency departments to better identify people at risk and to provide safety planning and better follow-up care through more thorough screenings. And in the criminal justice system, AFSP is working to implement training for detection and interventions at times of heightened risk for suicide, such as in bankruptcy and family courts. Partnerships are key to making a difference, which is one reason our chapter chooses a partner to highlight each year at a Sip in the Park with our Lifesaver Leadership Award. This year, we are pleased to honor McLean Hospital for capturing the complexity of living with a psychiatric disorder, seeking treatment, navigating insurance and healthcare systems, and facing stigma. In partnership with Massport and Logan Airport, McLean's campaign, Deconstructing Stigma, A Change in Thought Can Change a Life, boldly tears down misconceptions about what those with mental illness look like.
You know, behavioral and mental health issues are often frightening to individuals and families, and what compounds the pain is the degree of isolation. So what we really need to do is tear down the stigma.
Thank you to McLean Hospital and the Deconstructing Stigma campaign for showing us a very vivid and human portrayal of life and expanding the conversation about mental health.